How about now? Now you can hear me. Yeah, we were muted.
The 17th of September 2020. Notice was sent to the West Bend Daily News, Express News, WIBD, WMBZ Radio, WTKM Radio, My Community Now, Hartford Times Press, Kewaskum Statesman, and Milwaukee Journal Sentinel. We have a full house today, so we're ready to proceed. Would you please rise and we'll do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, I would entertain a motion to approve our consent agenda. Is there a second?
I'll second it. I have a question.
Oh, all right, is it on one of the items? Okay. All right, then all in favor, please signify by voting yes. Aye. Opposed? And that motion carries. On to our action items. And the first one is the proposed write-offs for Samaritan Health Center and outpatient therapy. And we have Mary Beth joining us via Zoom. Oh, okay. All
Hi,
right.
I'm Trisha Holbrook. I'm the business office manager at Samaritan, for those of you who do not know me. What we are proposing is writing off some accounts that we know we will no longer be able to collect on. So I put a list together and kind of a brief explanation of why we are writing those off. Does anyone have any questions about any of these write-offs? Hello.
Lois? Wait, you gotta wait till your mic gets turned on.
Okay, thank you. I have a question about the T19, the 45,884.
Correct.
Is that a number of accounts?
That is one person.
Okay,
So what had kind of happened with that account, we do have a process when people come in and they need Medicaid. We probably do about 20 to 25 Medicaid applications per year. Every now and then you run into a uncooperative family, for lack of a better word. So this was a person who the family was not cooperating with us. We finally got the application in. They needed more. Family did not want to cooperate. We eventually started working with the county attorney and someone at the ADRC to help pursue guardianship of this person. And as we were going through that process to get the guardianship, the person had passed away. At that point, there's really nothing we could do. The person was her own person, did not have any power of attorney to assist. We made every effort we could to get that completed. We were just unable to.
are those accounts eligible for TRIP?
Yeah.
Okay, and then my other question on that is, how does this total square up to the budget? Do you know how much the budget is for bad debt?
I do not know what it is last year. Dave, would you happen to know the number?
Generally budget somewhere around 140,000. Below 100,000 for around 100,000 for bad debt expense. So that's usually for every year helps it. When we actually write things off, it doesn't become an expense right away. It's written off against the amount.
Okay. Okay, I understand.
Yeah, since this has happened, we kind of revised our policy a little bit to push up the how quick we get to people who become uncooperative. Typically you kind of be trusting, you know, we're caring for your loved one, that sort of thing, and you give them time, you give them time, you give them time. Um, we've come to realize that sometimes some people just aren't going to cooperate, so we kind of revised our policy a little bit to move that time frame up where we're starting to pursue guardianship earlier, if that is appropriate.
And then is this the year-to-date?
This is what we're writing off. These are all dates of service, so this is for this year. This will be the total write-off for
Okay.
Samaritan.
Okay, thank you.
You're welcome.
I'm going to assume that because this was a Medicaid patient, that there was really nothing of an estate that had any funds in it to file a claim in either, correct?
That is correct. And that's the problem we get to when you have Medicaid people. They are out of money. They have no assets. In the case where, you know, someone would have assets or even a home, we would pursue a judgment with the county attorney. So eventually, you know, and we've had that happen where we've had judgments, we've had to write off because there was no money, but when they do eventually pass, we will get those payments back if there's something
Right,
later down the road.
okay. Any other questions from anyone? Okay, well then I'd entertain a motion to approve this, the write-offs for Samaritan Health Center and outpatient therapy. Okay, Lois and Les as a second. All those in favor, please signify by saying aye. Aye, opposed, and that motion carries. Thank you. Now, the next item is the Samaritan Health Center budget. Do you want to do that too?
I'm Tricia Holbrook. I'm the business office manager at Samaritan. For those of you who don't know me, I would be happy to go over and budget stuff that I am able to answer.
Okay, now let me just pull that one up because I have questions.
And Dave will also assist me here on this.
Okay,
Am I quiet? I've never been told I was quiet in my life.
all right. So just as an introduction, Samaritan is an enterprise fund. So that means it's a self-supporting governmental fund that sells goods and services to the public for a fee. And if I'm incorrect in that definition, somebody can speak up now. But I want to make sure that everybody on the committee and the board understand that. I think that's an important part that should be noted somewhere on this document for the future reference. That's spelled out for county board supervisors so they understand that. So there really isn't any tax levy money. Okay. So then, under administration, I guess, Margie's aware of this because I brought it up at executive committee. I have a problem with purchase services on all the department budgets, only because that can be defined differently for every department. So all I'm asking is a very short description of what's covered under purchase services.
Margie would be happy to answer that for me.
I was ready for you, Chris. So under administration for Samaritan, it includes repairs and maintenance, memberships, and marketing. In some of the other various areas, and you'll kind of be able to link these up when you scroll through. It's the laundry contract, it's the Medicare for speech therapy, dietitian services, pharmacy consulting, utilities, service contracts, vehicle maintenance, some housekeeping, and then psychiatric and physician services, nursing pool, labs, and x-rays. And then in fields, it's some of the same things: utilities, dietary, repairs and maintenance contracts, and housekeeping services.
All right, then my next question is on other expenses. That's a pretty big number, so I guess I'd like to know what that all incurs. Not all of it, but, and the same with,
Okay, so other expenses under administration is the amount we budget for the bad debt write-off. It's that last agenda item, that's where we budget for that. The other financing uses and under expenditures and under revenues, there's also a line item called other financing sources. Those are the same thing, two different sides of the coin. So as we noted, Samaritan is an enterprise fund. That means they carry their own fund balance or equity. During the course of the year, if because they don't have levy, anything that they may gain of more revenues that come in other than expenses, that drops into their equity. And we plan to either use that or build that. So those line items are either the use of that fund balance or the increasing of that fund balance. And it's all based on actual results for those columns that are actual or anticipated or budgeted items.
So the reason that I ask these questions is, I know we have an excellent budget in total for next year. I mean, the departments and our county exec did an excellent job. But we still hold the purse strings and we're still responsible for approving these budgets. And I think it's important that we understand where this money is going. It doesn't have to be anything in depth, but at least, in my mind, these are good questions that should be asked so that we have a good understanding as much as we can of how the taxpayer money is being spent. So then my other one is under dietary service. Travel and training. That went up quite a bit for 2021. So can you explain why? And I'm assuming that if we're still struggling with COVID, that may not get spent, but you're putting it in there in case
Yes,
things are
that
good.
is correct. And that
Okay.
would be for, 2 people. Currently, we only have 1 person that would require training and travel, but in the future, we do anticipate in having 2.
Okay,
So that would be an additional person that would require additional training.
okay, you use the word required. Does that mean something that the state needs you to do, or?
No, we, there's certain trainings that come up throughout the year that are beneficial to the organization and, the person, especially management,
Uh-huh.
Sanitation training, different types of
Okay,
food
right.
beneficials, that sort of thing that are of interest.
okay.
that we
And
would-
that's important. I'm a
Mhm.
big proponent of that, so that's fine. Okay, so that answers my questions. Anyone else? Oh, you do too? All right. Okay, Lois,
I'll
go
try
ahead.
to, I'll try to be brief. I'm just looking at, in that line, other revenues and admin. There's like a $600,000 reduction in other revenues. Do you know why that is?
Do I know by that is. That is probably due to the reduced amount of people we plan on serving. Due to some of the staffing, we've reduced the number of people over. So we're anticipating this year, we averaged about 110 was what our census number would be. Next year, we're budgeting for about 100 people. Just due to being able to care for the people properly, an increase in kind of the rehab where those are more in and out people and a decrease in the long-term care.
Wouldn't that be under public charges for services?
Oh, my
I'm-
bad.
Okay, yeah,
Okay, well, see, they put it in this weird format and I don't
Okay.
understand it.
okay.
My apologies. That would be our supplemental payment. So supplemental payment is something that the county home receives from the government to cover our direct care worker losses. And that supplements some of the losses we take. In the last 2 years, because of the closings of nursing homes, there's been an additional kind of pool of funds that have gone out in excess of what we anticipated. Next year, they're saying those excess funds will be depleted and we will not receive those anymore.
Okay, and then similarly, under other financing uses, there's a big increase of, as an expense, $665,000.
In 601,
You have numbers, I do not. It's called other financing uses.
That's the fund balance that I spoke of earlier.
That's the fund balance transfer in.
Correct.
So actually, is that a loss coming back?
So if it's other financing uses under expenditures, that is use of fund balance. If it's another financing source in a revenue section, then that would be us using our fund balance or our savings account. Or I'm sorry, I've got that. We're budgeting to, yeah, so we're budgeting to add to our fund balance.
That's what I needed to know. And then I noticed under building maintenance, under purchase services, there's like a $55,000, not a lot of money, but is that chillers or what? Oh, is that what that is?
Is that the chiller there?
It's under building maintenance.
Yes, that does include our chiller rental.
Okay. And then what is activity 611?
That is our activity department budget. So our therapeutic rec department.
Oh, it is an activity.
Yeah.
Okay,
Yeah, it's a department. so
okay,
We now call them therapeutic recreation assistants.
okay.
Oh, fine.
Sorry.
Okay, so I guess we can direct our questions. Are they?
I'll stand here just in case.
Okay, go ahead, Lois.
Okay, and I was just looking in the revenue under occupational therapy, that went down by $65,000. I think it was a large percentage. Is something changing?
Can I answer that question?
Sure.
Is that okay?
Is that okay with you, Mary Beth?
It's fine. That's fine.
So the way Medicare paid us changed in October of
Okay.
this year. Prior to this new payment structure, it was heavily based on therapy, where it is not therapy driven anymore. But because of the amount of rehab, we are seeing more therapy services being done because of the ins and outs and a lot of hips and knees and that need quite extensive rehab.
Okay, so let me see. That was in purchase services under the expenditures, but it
Mhm.
went down. Okay. It went down. So are you sure what you said?
Yes,
Okay.
because we're doing kind of shorter stints. We, are bringing people in, they're having the rehab.
Okay, and then, okay, well, that's good.
I just want to add that the methodology has changed as well. So predominantly before there would be a stratification of physical, occupational, and speech therapy. And because that methodology changed, there are fluctuations among those three therapies.
Okay. And then the last question I think I have is under fields of Washington County. Let's see, other finance expense went down 79,000. Okay, so the expense is going down, and why would that be?
That's also fund balance. So Fields is separate from the Samaritan Nursing Home. So
Other is really fund balance is,
anything that says other financing is fund balance, correct?
thank you very much.
Any other questions? Pam? Okay,
Yeah, I have some clarification questions too. You spoke of purchase services, memberships, pharmacy consulting, nursing and physicians. So first, like memberships to what?
Mary Beth, would you like to chat?
Sure, yeah. So we belong to a trade organization, Leading Age Wisconsin, which then also is with Leading Age National. They look at advocacy, they look at regulatory, financing, all of that sort of thing that is really imperative for us to get the information from them. Additionally, previously we had Leading Choice. Leading Choice helps with contracts such as with United Healthcare, network, that sort of thing. So they do the negotiation of those rates on behalf of a conglomerate of nursing homes across the state.
Okay, thank you. And then when you spoke of pharmacy consulting, nursing and physicians, are those like contracted out individuals or?
The pharmacy has a consultant that comes in on a monthly basis. Am I correct on that, Mary Beth?
That's correct. That's per regulations. They review all of the resident medications. Correct.
Okay, so that's not an FTE individual or
it's-
county? Okay.
The company who provides the medications.
Okay. And then the nursing and physicians, same type of thing?
Medical director, we do pay for his services for the oversight in the nursing home.
Okay. All right, and then I'm curious, you talked about, you have this gap in the revenue and you're looking at decreasing your census essentially, capping it off at 100. Has there been a waiting list ever this past year? And you said too, it was due to staffing and recruiting issues or staffing issues. So I'm wondering how your recruiting is going because I have seen recruitment
Yes.
things out
And
there.
I'll let Mary Beth answer
Okay.
that one.
Right. We thought it was reasonable. We take a 3-year look at trends relative to occupancy as well as payer mix. We do know that this last year there was an anomaly, of course, with the COVID piece. So we do take that into consideration. Because of people being, so many more of our residents being short stay, our occupancy decreases because rather than somebody staying there for a year or two, they're in and out generally 30 to 45 days. So every time we're filling that room, there are those ins and outs. Yes, we have held on our occupancy at times because of staffing. So we are working extremely hard at that. That's a national piece that, again, from a leading age piece and part of my role is to help from an advocacy. Also have been working with finance as well as HR on recruitment strategies. But there is a significant challenge of hiring for certified nursing assistants. Our nurses are pretty good right now, but certified nursing assistants, for example, we have, so don't get frightened, but our October open shifts for nursing, we have over 300 open shifts for nursing right now in our nursing assistants. So we're working extremely hard on making sure that we've got adequate staff to handle the residents and not putting them in an unsafe situation.
My goodness, thank you. Anything else? Yeah, just one more question that wasn't answered. Do you ever have a waiting list? Because I've been on the other end, I'm a nurse and having people sitting in the hospital that I serve, having to sit in our intensive care unit even, or whatever, acute care bed until a long-term care bed opened up, in the county or somewhere else. Do you ever have that situation? Or do you have data on that where there's actually, the amount of people that had to wait a day or two before they actually were admitted to you all?
So we have a waiting list both for the fields, both the CBRF and RCAC. We have waiting lists for each of those. In the nursing home, we do not have an active waiting list. We also are somewhat restricted based on the COVID positive rates, where we, excuse me, where there are times that we have to wait on an admission. Yes, we do know that there are times that people in hospitals are needing to wait, and that, as evidenced by a call this afternoon, that's happening across the nation. Brown County, I think right now had minimal, because of some outbreaks up there, only 2 spots that were taking residents. So we try to manage, again, mostly based on what we have for staffing.
Thank you. Yeah, because I'm trying to think of our community partners also, the hospitals within our county that we, serve and partner with. I just want to make sure that we're meeting their needs too and not having a long waiting list for them. Thank you.
Sure.
Yes.
Push the button? Nope. Oh, thank you. You haven't sat in this seat for such a long time. In formulating a budget for the new year, like 21 now, And I've got a comment on the expenditures and other uses. When you have purchase service, you're outsourcing service for the people in the county. When there's quite a difference between 20 and 21, where when you outsource a service, we're locked in by contract to a certain amount. Is that correct?
Correct. If we're in a contract that is locked for a certain
Now,
period
the
of time.
deviation, does that involve increase in numbers that they care for in a certain category, a certain population, or does it go by percentage, by increase?
Our contract in like regards to what are you speaking of? I guess I'm not understanding. Yeah, I mean, typically our contracts run for, I mean, it could be anywhere from 1 year to 5 years. Contracts are looked at on a yearly basis. I know our housekeeping contract alone, we had locked for 7 years, with no increase. So it just depends on who you're dealing with. I know for our pharmacy contract, we were able to partner, with kind of a group purchasing that will save us, they estimate about $40,000 in a year. So, I mean, we do look at ways to renegotiate contracts if they're getting too high, but typically we kind of take the lead on what services we're looking for and what pricing. That's all well thought out before that contract's ever signed by the county.
So once we sign a contract, and that's it for that period of time, right?
Correct.
And the number of cases involved that reflect the care of a given need, that can fluctuate, but the cost does not. Is that correct?
Correct.
Okay, thank you.
Any other questions from anyone? Okay. Do we need motions to approve this budget? Is that, okay. Well, then I would entertain a motion to approve the Samaritan 2021 Health Center budget. Pete, second, Les. All right, all those in favor, please signify by saying aye. Aye. Opposed, and that motion carries. Thank you, you did a great job.
Thank you.
So did you, Mary Beth.
Yeah, sorry about that.
All right, our next one is the Aging and Disability Resource Center budget. Tammy, you're up.
Hello, good evening, everybody.
And I have questions, but I got to get there.
Okay.
And I just pushed myself out, so. This is a strange budget. Under home modifications.
Sure.
As I find that. Oh, there it is. Okay. That one, and in addition, health screenings, volunteer support, and meals. All the revenues, the total revenues and expenses are the same. How do you manage that? I'm not an accountant, so how does this happen?
So I'll speak to, I can kind of lump home modifications and the volunteer support services together.
Okay.
So we get funding from federal 3B, it's called, through the Older Americans Act. And that can be utilized for certain things for people that are 60 and older. And so with home modifications and again, with volunteer support services, those are things that we are assisting with individual clients or in the community. So for example, volunteer support services, we help purchase equipment for the help corner. which is run a partnership between Interfaith Threshold Aging and Disability Resource Center. So if funding allows, which we usually earmark $5,000 to $10,000, we will say, what are you guys in need of? Usually there's a high need for knee scooters and bariatric wheelchairs, and we help purchase that equipment for that service. It is the only loan closet in Washington County, and we feel that it's a important need. Same with home modifications. That's more for individual clients. We set aside the $10,000 to be able to help individual clients based on needs. I review those to provide things such as stair lifts or maybe a special chair for their shower. And the ultimate goal is to keep people in their home as long as possible and keep them as independent as possible with that funding.
All right.
Health screenings, you had questioned like the in and out. So the revenue is what we get. Then we most of this in-house screenings is for our contracted nurse that provides wellness classes throughout the county. The rest of that we are unable to cover comes out of our ADRC budget.
So on these accounts, then you spend that money, and when that's gone, that's it, right?
Correct.
Okay. Okay, just a minute. I think I have one more.
Or I'm sorry, Chris, just to clarify, once it's gone, then it's either gone or we're able to utilize another funding source if
Okay,
able.
but not taxpayer? Not,
Correct.
okay. So there are really only two that are taxpayer funded, correct?
Yeah, taxpayer dollars are for our meal program. That is just something that we haven't seen an increase in a long, long time. And then a portion of administration costs, which is my work at the ADRC, a portion of my work at the ADRC, and Heidi Fellens, who is our accounting technician at the ADRC. And because we oversee accounting and functions of the aging program, and the aging program is not fully funded, and we haven't seen an increase in a long time, those dollars come out of tax levy. So we are unable to, I tried to a couple of years ago, take all of our salary and wages and all of the functions we do out of the ADRC funds, but you cannot, because there are programs we're administering that are just aging programs.
Okay,
Does that make sense?
yeah.
Okay.
All right. Okay, go ahead.
Okay, so I know how this works, the revenue and the expenses tie out.
It's magic accounting.
It is.
I don't
But it's
know that I fully understand it either.
well, that was going to be my question. Is it because you have a fund balance that's a positive that you're able to do that at this point? It would maybe require a levy or
So ADRC is a separate fund or a special revenue fund, but we in accounting and for government accounting call it closing to the general fund. So they do not hold their own fund balance. We don't plan or budget for a use of fund balance. They get tax levy dollars. So for those that balance out to zero, it really is kind of what Tammy alluded to. We get a bucket of money to do those services. We either restrict our spending to that bucket or we supplement with some of these other sources.
I understand.
Okay, any other questions?
Yeah.
Yes, okay, sorry.
My first question, under the health screenings, you have grants and loans. Could you please extrapolate on that?
Certainly. So the grants and loans is money that we provide to the senior centers or community centers in the county. So there is 4 of them that we're currently working with. In the highlights section, you'll see we're trying to work with a 5th. Again, that comes out of the Older Americans Act money. So if the senior center, community center is providing certain eligible programs, we then reimburse them with those Older American Act dollars to provide those services. So we have staff within the ADRC that are providing some of the programs, but if the senior center itself is able to provide it, we're able to reimburse the senior center for those services. So that is what grants and loans is.
Okay, then how do you evaluate those services to ensure that that's where your money should be going?
So they have to provide documentation to us that then goes into a database. For example, one of the senior centers just held a yoga class. They provide a description of that class, and that was for seniors specifically, a roster, how many times each person attended that class, and then that all gets plugged into a database and associated with a certain dollar amount per unit. That's kind of our backup to the state. And then we have pretty close relationship with those senior centers or community centers. A lot of them we're doing our meal programs in already. And Kristen Hoskin, who's our nutrition and wellness supervisor, is also in those centers quite frequently, also providing classes. So we're having pretty regular contact with the senior center directors, and the documentation they provide kind of gives us our basis for being able to say, yes, it's an eligible program, yes, it's successful, and yes, we'll reimburse you for those expenses.
Okay, and do you get like any patient satisfaction type surveys or have a type of process for that, for the individuals using your services?
I don't believe that not through the senior centers.
Okay.
I can certainly ask Kristen if she's gathered. I believe that she gathers those for her own classes, but I don't know that we're doing that for the senior center
Okay. Or
classes.
do you do like a gap analysis to assess what services maybe we should be offering, or to look maybe to offer in the following year to budget for?
Yeah, so in working with the senior centers, they really have a good handle on kind of what the needs are. So for example, West Bend Senior Center, it's called Senior Center, Senior Citizens Activities Incorporated. They were noticing that some of their seniors were wanting to try what some people might consider more of the new age things, the Tai Chi, that sort of thing. And so we did open up the funding for them to be able to try that and then report back as to its success with the seniors. And it was very successful. So more of an informal analysis, but we are in constant communication with them.
Okay, but no formal gap analysis process. Okay.
We do that as part of our aging plan. So every 3 years we have to put in place aging plan. And right now the current year is 19 through 21. I go out and meet with seniors in the community and find out what the needs are, what they think they are needing. And there's certain focus areas, but then there's also that kind of other column of other things that they might think are important for their health and wellness. So I'm gathering community input, and then also in partnership with some of the hospital systems do and I'm totally blanking on what it's called. You might know because you're a nurse there. It's a community analysis as well. And so we kind of talk about those in conjunction. And they fall around the same time, but we've talked about how we really wish they were the same exact time because we're kind of
So you could
doing the same
partner.
thing.
Yeah.
Yeah.
Yeah, I was curious.
We have a
about that.
strong partnership with Aurora, the YMCA, and a little bit with the Freight Art system as well. So,
Okay, thank you.
yeah, you're welcome.
Fun work.
And that's for you to say,
Well, I
not
think
for
that would
me.
be fun.
Call me. We can talk about ideas.
All right, any other questions? All right, then I'd entertain a motion to approve the 2021 Aging and Disability Resource Center budget. Lois, second? All right. All those in favor, please signify by saying aye. Aye. Opposed, and that motion carries. Thank you, Tammy.
Thank you.
All right, Julie, you are up next.
I am up. Can you guys hear me?
Yeah, it's still, I hope at some point we can improve on this part of. Oh, really?
Yeah.
Okay.
Say
Well,
that again?
the employees, so I don't know how if we. Okay.
So can you guys hear me or is it very quiet? Are you saying it's very quiet?
All right.
You can't hear me. Okay.
That's better.
That's better. You can hear me?
Yeah.
Okay. I have to talk
Just
right
pretend
into.
we're your- Just pretend we're one of your daughters and you're yelling at us.
Well, the tone of my
Yeah,
voice
use
would
the
not be
mother
as nice,
voice.
though. So I'm just going to start off, and if you tell me if you can hear me rather than just staring absently at my face. But I just wanted to start off and thank you for seeing our budget for 2021 and for letting me present it to you in this way. If there's nothing that sort of shows what 2020 has been, is giving your budget presentation virtually. So I just wanted to highlight a couple of things. One being that this is the 4th year that the Human Services Department has met and exceeded our budget target. And we're very proud and pleased to present this budget to you, having reduced this year's tax levy by 3.7%, even as we have increased our overall budget for 2021. We've achieved this by focusing on capturing all available revenue and diversifying our funding. And we've done this through insurance reimbursement, successful grant awards, and charging for services when appropriate. And our focus within our department continues to be on quality improvement strategies that simultaneously improve program efficiencies and client outcomes. So I'm willing to answer any questions you might have about the budget. I have some very talented folks in the galley here with us today that can help answer those questions, and maybe you can hear them a little bit more clearly. So if you would just like to ask any questions you might have about our budget, we'd be happy to go into more detail.
Okay, thank you. So under the administration, can you explain the interdepartmental charges?
Yep, so the interdepartmental charges for us are things like IT, rent, county attorney services.
So these
Those
are all
types of things.
negative numbers though, right?
Correct. So as with similar to other departments, they do have interdepartmental charges for rent and IT, as Julie had noted. The unique thing about the administration portion of HSD's budget is they allocate out all of their administration costs into those other divisions that are shown in their budget here for like behavioral health and economic support services. So that's why you'll notice that for 21 and for 20's budget, that there's no property tax levy impact in administration. It's because all of those costs are allocated out to the other departments. So it shows a negative here, but then the positive amounts are in those other sections.
Great, thank you. Then under outlay, I'm assuming that covers the new electronic health record system. Is that correct?
Under administration, yes, there's no budget for 21. Correct, because outlay is normally a one-time cost.
So that 1.2 is for the
Yes.
Then under behavioral health,
So Chris, I just want to add to that component. And so we won't spend, we put it as it's going to be expended all for 2020, but then whatever we don't spend will be coming to Human Services Committee and requesting that to be non-lapsed, because we are anticipating it taking 4 years to expend the entirety of the funding for electronic health record.
okay. All right. And that's the normal procedure in that kind of a case.
Mhm.
All
Right.
right, under behavioral health, the summary indicated a $108,000 increase, but 2021 requested budget shows a decrease of 54,000 plus. So can you explain that to me?
In what line item? I'm sorry.
The There was 100. Oh, the summary, your summary notes
Mm-hmm.
at the end indicated $108,000 increase. But the 2021 requested budget shows a decrease of 54,000.
She's talking about behavioral health personnel, Julie.
Oh, right. So if you're saying the difference in when we reduce the positions, and then you're saying that that doesn't add up. Some of the change in our personnel just actually came out to what we ended up paying in salaries and changes in positions. And so any decrease or increase wasn't 100% connected to actual reduction or addition of staff. Some of our personnel numbers, in fact, pretty much across the board, our personnel numbers came in under what they were the previous year. And some of that has to do with, I think, projections for positions that weren't filled, and then filling positions when people left and maybe filling them at a lower rate.
Okay. All right, then under behavioral health again, under revenues, the fines, forfeitures, and penalties.
Mhm.
Is that something that you work with the clerk of court's office to estimate what that might be for the coming year, or how is that figure derived?
Yeah, so you're correct in that we do a lot of our projections for revenue based on previous years, tend to look at a 2 to 3 year trend, and then also what we're projecting for the current year. You know, this has been a weird year to project for a lot of things, but that's where we're coming at some of those numbers. So every year in, different categories for our revenue, we might be increasing or decreasing different line items based on what we've seen the last 2 to 3 years. And so that's essentially based on what we've been receiving from the clerk's office,
Okay.
clerk of court's office.
I only ask because I know the sheriff's department used to contact me to get a number for their budget based on our information in the clerk of court's office. So I was wondering if you did the same thing. You did, it wasn't done when I worked here, but I thought maybe now you were.
Mm-hmm. No, I don't contact them directly because I have somebody in finance, Kathy Wild, who runs monthly reports for me. And then she's put all these huge spreadsheets together so that we can come up with projections and estimates
Okay.
based
All right.
on what we've received.
Well, I do want to applaud you for decreasing that total budget by over $300,000. So that is fantastic. So good job. Questions from anyone else? Lois?
I just wanted to say that your notes at the bottom were very helpful. I mean, there's a lot of detail here, so it saves the time here where we have to ask a lot of questions, unless we want to ask a question for the public to hear it. But the notes are excellent. Thank you.
You're welcome. Thank you.
Any other questions or comments? Pam?
Just a comment. You speak of your electronic health record outlay, and you stated it was essentially a one-time budgeted item. But I've gone through electronic health record implementations and upgrades. I'm just wondering how you plan on sustaining this, because things do change. You need to continually make edits and really upgrade your electronic health record and budget for that. I did serve in a community or in a healthcare system that did not do that, and it ended up being a very costly 3-year process to upgrade.
Yeah. So our electronic health record journey, I like to describe it, has been going on for about 4 years. We are 9 months into the implementation of our new electronic health record. And we did come to the Human Services Committee and the County Board over a year ago and requested a general fund transfer to help us fund the implementation and ongoing maintenance of the electronic health record for 5 years. And so that's what this number represents. So you will see this number continually being requested to be non-lapsed until it's expended down. But what we know from doing the analysis for the request of a new electronic health record is we are leaving a lot of money on the table, even though we've improved our revenue capture immensely in the last 3.5 to 4 years. We are still leaving a lot of money on the table just because of the issues that we have with the current system. And so we're anticipating that we will have increased revenue, which then we will budget for the ongoing maintenance of this system, because there is a yearly maintenance to that, and then planning for what we know will be continual upgrades. As we get better data and we get more information, we know that we're going to want more. And so that always comes with a price, as I'm sure you're aware, because every time you want something new, there's a price tag to that. And so we will be using that increased revenue that we know that we're currently not capturing and that we're losing to help support the continuation of it.
Okay, thank you. So you do have a process to capture essentially the return on your investment when you're speaking of that revenue.
Yes.
Very good.
All right, any other questions as far as the budget? Okay, then the other item that we do have to approve as part of her budget is the Human Services Department user fees. And there hasn't been a large change in the fees that have been presented. However, the guardianship fees are new. At least it appears they're new. Is that true? Julie?
That is true, and that is accurate. And Sandy Holford, our Assistant Human Services Director, is here today, and she can give you a little bit of background on where we came up with those numbers and what that is connected to.
So, and as we do every year in Human Services, we like to look at different programs. Where can we generate new revenue? What programs haven't we been charging that we can charge for? So in cooperation with the County Attorney's Office, who helps take families through guardianship, we worked with Brad Stern to limit the people that we perform guardianships on. So we limited the assets that people can have, instead of anybody just being referred to us, from clinics to the ADRC to anybody in the community coming to us to say, hey, I need a guardianship on this individual. We have funneled it down to those that are most in need, that our County Attorney's Office will help through that process. And then along with that, we did family size, we did the amount of income they can have, along with, like I said, the assets. And so Brad helped us along in terms of what we can recoup and what statutorily the amount of money that we can recoup. And that's why that was our new program revenue for 2021.
Okay. That was going to be my question. I wanted to make sure that the statutes allowed for this.
Yes.
So, okay, great. Question.
And if I could add something, Chris, if that's okay. We have a state statute called DHS 1 that dictates for us what we can charge for services. And so even though within the user fees, you can see the max amount that we can charge for services, we still do have to take into consideration ability to pay, based on income and family size, as Sandy was describing. And so, sometimes you might look at this and seem like, oh, $300, it seems like a lot for somebody who doesn't have a lot of money. That is not what we actually would be requesting, a family who has limited assets to pay. But this just sets the standard and the fee, but we do have to, by state statute, adhere to the income guidelines. And so then what we actually end up receiving as individuals share to pay sometimes is significantly less and sometimes nothing.
Yeah, understood. Any questions from anyone on the fees? All right. Then I would entertain a motion to approve the 2021 Human Services Department budget as well as the user fees that have been presented. And that is Sarah's motion and Les second. All those in favor, please signify by saying aye. Aye. Opposed, and that motion carries. Thank you, Julie.
Thank you so much.
Okay. Samaritan. Next item is Veteran Service Office budget, and that's Kurt.
Hello, everybody.
I like your budget.
Thank you so much. The gallery is dwindling here. Thanks for letting me be here. Always love budget time.
Oh,
It's one of the
anytime.
few times I get to see all of you. We're kind of a workaday department. We buckle down and keep helping vets, so we don't get a lot of opportunity. But glad to be here. Not a lot of major changes in the budget. Not any real peaks and valleys. We did cut travel based on no travel. We did end up being able to do a remote training for a National Service Officer accreditation, which was the first time they did that. It was very productive and effective. That was great. But otherwise, pretty static budget.
Well, I have no questions on this budget.
Wow. Well, great.
Okay,
Okay.
that leaves that side out. Anyone on my right have questions? No? Oh, wait, Pam's pulling her mic down.
No. That's good. That's good. No, please.
It's just more of a broad type of question.
Certainly.
I serve the VA now myself, and it is, National Suicide Awareness Month for veterans. I'm just curious, are there any, unmet needs or things that you would have wanted to add to this budget, but didn't?
No, not at this current time. We, in Washington County, there's a lot of really active veteran service organizations. So when we do have an occasion where we have homeless veterans or we have crisis veterans, when we have veterans that are really in need of either immediate financial support, housing, food, those types of really critical elements, we're able to gather around them as a community and help them in almost every situation. The VFW in West Bend deserves a lot of those kudos. They're very charitable and they help veterans directly quite often when we call them for help. And then also federal organizations like CVI, which is a nonprofit that manages federal funds. They help with housing and utility assistance and things like that. All the programs are temporary. They're 3-4 months. But between that, economic support, primarily through K. Lucas with Salvation Army funds and Heat for Heroes from the state, we are able to help most of the veteran needs that we get. We do occasionally get transient veterans that are coming through Washington County, and usually they stop in Washington County because they don't want to go to Milwaukee for whatever reason, maybe just because services are harder to come by. That's where things get a little difficult in order to help them, but we do usually find a way. Yeah, thanks for the question. Appreciate it.
All right, then I'd entertain a motion to approve the Veteran Service Office budget for 2021. Pete, second. Pam, all right. All those in favor, please signify by saying aye. Aye. Opposed, and that motion carries.
Thank you.
All right, then we're down to our last one, the 2021 Washington Ozaki Joint Health Department budget. Is anybody presenting on that?
Right here.
Oh, there you are.
For those of you who haven't met me, I'm Kim Beekler. I'm the business manager for the health department. I know our budget looks a little different than everybody else's. I don't think you have a whole lot of detail. If you have any questions about that, I can try to answer them.
Can you explain it? This does get approved by the Ozaki Board of Supervisors, right?
Correct. It went to Ozaki yesterday.
Okay, and they approved it?
They did.
Okay, all right. Are there questions on this? Yes, Lois.
I know there must be an agreement for this, but what determined the 60% payments from Washington County to Ozaki County? What is that for?
It's per capita split. So we have more people in Washington County versus Ozaki County. So
Okay.
that's what it's based off of.
And is that a contractual thing and it stays the
Yes.
same? And how long is that contract there?
It's a standing contract. We are in agreement until we
Or
decide.
no longer?
Yeah, until we decide we are no longer.
And the per capita portion of that agreement will be updated every time there's a new census. That's part of the agreement.
The county money by doing this joint Board of Health. So, Pete.
Over here. Oh, question. Do we, as far as budgeting goes, they have an accountant, we have an accountant. Do we work, I mean, you look over their books, they look over our books. How does it,
So for the,
that we wouldn't do?
So for the health department, Ozaki County is the fiscal agent, meaning they basically kind of do the accounting for the health department. For the budget specifically, the health department has a board of health, and the budget is presented to that board, and then done through Ozaki County's process. Washington County Finance Department gets reports from Ozaki for that budget. So we do get a chance to look at it, but a lot of the time the information we get from the actual health department, Kirsten and Kim specifically, is a little bit more helpful than some of the summary reports we get from Ozaki. But we've never had an issue where we haven't gotten any information that we did request from a financial standpoint.
Asking Margie, do you yourself get involved with that?
I don't get involved in setting their budget, no, but I do get copies of all the budget information and we do review it. And in fact, this year, there's been a lot of back and forth between Washington and Ozaki on the budget and questions.
In the Board of Health, Chairman Creefall and myself serve on that board as well as one other county supervisor. So. Okay, yes, Sarah.
Been so quiet.
Yes.
Two things. First of all, credit to a reduction in your budget for next year. That's a bold move, given where we are, first of all. And second, given the breadth of the programs that you do, is there any thought to breaking this out a little bit like maybe some of the other department budgets that we've seen? Again, the vast array of things that you do, this is really a very large bucket. Is there any, and I'm
So we aren't able to split it out on our end because that detail is not in our system, based on the intergovernmental agreement between our county and Ozaki. So we just basically give Ozaki the 60% payment on a quarterly basis. What we could look at doing for future budgets is providing some kind of an additional summary from the health board themselves, kind of breaking out some of that program information.
we've heard some great budgets tonight with a lot of detail, a lot of summary. It's just a really large bucket to just approve wholesale. I think that would be my only question and recommendation. And thank you for the work, because it's been kind of a crazy year.
Yeah, thank you to reflect Sarah's comments there too. I don't really know what I'm approving. It looks beautiful because you got a reduction, but then in some ways too, that does worry me a little bit too with the pandemic.
Well, some of that is based on, our budget is kind of out of whack this year, just in general, because we've gotten COVID funding. Obviously, that's playing a large role in it. I can give you some of our highlights for the changes that we're making next year, if that would give you a little bit of an idea of why our funding is changing. But one of our biggest highlights is that we're restructuring our staffing. We are eliminating our nursing supervisor position, and we're creating 2 different management positions. One will be a health strategy director, and then the other one will be a community health director. And the reasoning for that is because the pandemic has made it very abundantly clear to us that we need more communication between our nursing staff and our strategist staff. And we are trying to form a better partnership between all of our staff. And so that's a little bit of why our numbers look slightly different from this year. But most of that is just kind of realigning current staff into different positions. So that's why it's not a huge change in funding, if that makes sense.
Go ahead, Lois.
I guess it would be helpful if we saw their budget and then 60% is our portion so that we can see what is in the budget rather than just a number.
Okay. This is yeah, I don't know how to explain it well enough, but I think that intergovernmental agreement that we have with Ozaki County, as part of that agreement, they were the ones that were going to take care of this part of it, correct?
Our portion of the agreement was to essentially fulfill our 60% share of that joint health department. So the reason we've shown it like this historically ever since the merger is because our county, we don't really have any of the, and neither does Ozaki County actually. We don't have control over the operational or the business decisions. That's the joint board of health. So when they establish their budget, they make those decisions, which are the decisions that you guys make for the rest of our departments here. And so the reason it's presented differently is mainly because of where that line of who kind of intercedes into what area of that budget. So I don't think it would change how we approve their budget, but we could definitely provide some more information so you know a little bit more of what's behind that budget number.
So are we going to be on the joint board of health? Are we going to be seeing, that's the committee we're on,
Right, no.
So are we
yeah.
going to see a budget?
I know what you were talking about the changes in your staff was discussed at the
The
last.
Board of Health
meeting.
saw our budget at the last
Yeah.
meeting.
So we did look at then, you didn't get on or you weren't there for some reason. It was a Zoom meeting.
I don't believe that I missed any meetings.
Okay, well,
It was
I know
just
there was one.
last week was our last.
Yeah.
Yeah.
Were you at that one?
Yeah.
Oh, okay, well, I've gone to so many meetings this month, I can't
Okay.
keep track of who's where. But that was talked about, remember the staff changes? I think Kirsten had brought that up. So,
But we didn't actually have a budget.
no, it's probably similar to this, if anything. I
It
can't
was a
remember
little
what
bit more
was-
broken down, but not an
presented.
extensive line item.
Yeah, I don't know what I'm approving.
Yeah, so I don't feel comfortable approving this.
That's your choice, you know. All right, any other questions at this point?
I appreciate the thoughtfulness that goes into the process. I mean, at this point, there are other levels of oversight that have happened that I'm gonna trust in. I hear what you're saying. But I think in the future, for me, just to speak as a representative of citizen member, to talk about that, I think it is helpful to have the additional detail. So understanding that while we may not hold any power decision-making authority in regards to where the budget's happening, because that happens somewhere else, that's fine. But I think the additional detail would be helpful. So thanks, Margie.
Okay.
Then are we the right body to approve?
Well, we are spending 60% of this as our cost, so, yeah, it's part of our budget. Did you want to say something, Matt?
Well, I can't add too much more to it, but this is a contractual agreement. And so what you're doing is you're looking at this as a tax levy outlay and through our contract of services. We're not asking you to look at line by line, because with the contract, that obligation is given to Ozaki County. So I'm not certain, and Brad's not here, but I would say we're asking for your approval of the tax levy portion of the contract, which is 60% of the total. I don't know if that helps.
Okay.
We did. Or you did.
Okay. I don't remember, I'm sorry.
I mean, I'm looking and see the budget here. And I'm just gonna go back to the agenda.
I think what Matt said is, I know it's correct. If that's enough for. All right. Okay, then I would entertain a motion to approve the 2021 Washington Ozaki Joint Health Department budget. Sarah and Les second. All those in favor, please signify by saying aye. Aye. Opposed? Two. Okay, and the motion passes. Okay, our next meeting is Wednesday, October 28th at 4:30 PM. That is all in front of us today, so thank you, everyone. And have a good evening. Yeah. And that's fine. Yep, sure.
Yeah, if we're accountable, we need to be informed. We have to make an informed decision.
Yeah.
Not just
See ya,
be like-
Les.
Just like you cast a vote for for anything, you make an informed decision. And I'm not, I mean, it looks, yeah, it looks great, not everyone, but I have no idea.
I'm just hopeful that the other committee that approved the budget in detail has looked at it, so I trust